Okay, so let's talk a little bit about red blood cell production. So blood cell production in general, like all of them, is hematopoiesis. But if we talk about specifically red blood cell production, that's erythropoiesis, right? Because red blood cells are called what? Erythrocytes, right? So making erythrocytes is erythropoiesis. This occurs in the red bone marrow. Last lecture you guys told me in adults, where is red bone marrow? Spongy bone, right? Between the trabeculae, between those rods of bone in all of those open spaces that we have in spongy bone. We see that blood cell production begins with a stem cell called a hemocytoblast. Okay, so actually all blood cell production begins with hemocytoblasts, not just red blood cells. So we see these hemocytoblasts. Heme referring to blood, cyto like a cell, right, blood cell. Blasts are baby cells. Remember that from, we talked about it a few times, like osteoblasts, right, with a baby bone cell. It's an immature cell, but blast and babies match up, right? So a blast is like a baby cell, an immature cell. So these are like stem cells, right, or like immature blood cells, hemocytoblasts. They divide, and those give us two different types of stem cells, myeloid and lymphoid stem cells. So hemocytoblasts give us lymphoid stem cells and myeloid stem cells. Lymphoid stem cells give us a very specific type of white blood cell called the lymphocyte. Okay? Lymphoid stem cells give us lymphocytes. Myeloid stem cells give us everything else. Okay, so myeloid stem cells then give us all the other blood cells. So red blood cells, platelets, and if you've had lab already, what are the other white blood cells? Neutrophils, eosinophils, basophils, right, all of our phils, and monocytes, which become what? Starts with an M. Excellent. Okay, so myeloid stem cells give us everything else. Lymphoid stem cells give us lymphocytes. So right now, when we're talking about erythropoiesis, this is what's happening, right? We're talking about our hemocytoblast dividing into a myeloid stem cell, and then eventually, this is actually numerous steps later, we get to our erythrocyte or our red blood cell. Okay, we'll see that we have like proerythroblasts and erythroblasts and reticulocytes. There's a lot, but we are starting at these hemocytoblasts, just like with all of our other cells. Here you actually see the maturation or production of our red blood cell or our erythrocyte. I put in red the things I expect you to know. Okay, I won't ask you how many days, and I don't expect you to break down the different types of erythroblasts. Okay, just kind of very generally. Again, what do we start as? On the other slide we talked about it, but what do we have first? Before that? Hemocytoblast. That gives us what type of stem cell? Myeloid stem cell. The myeloid stem cell gives us a proerythroblast. Pro like pre, right? Erythro like our erythrocyte, right? Red. And a blast is a what? Baby cell. So this is a baby pre-erythrocyte. Then we have our erythroblasts, right? We get rid of this pre thing, and we just have erythroblasts. So that's like our baby red blood cells. We go through some changes here. You can see here we get rid of the nucleus because do red blood cells have nuclei? No. No. So we eject that nucleus. And then we have something called a reticulocyte. We're still not our nice like biconcave disc shape, but we're pretty close. That that reticulocyte gets ejected into circulation and is our mature red blood cell. So you see we're from the proerythroblast to the red blood cells about a week.
Where does the nucleus go?
It just gets broken down, and whatever can be used gets recycled. And then the rest of it gets put into the waste. But there are amino acids and stuff that can be used. All right, so obviously we need to regulate erythropoiesis. What is erythropoiesis? Red blood cell production. We need to be able to control it or regulate it, right? We want to make enough red blood cells, but not too many. So we do that with hormones. We have a couple hormones that we'll talk about that help us to control red blood cell production. But real quick, in order to make red blood cells, we have to have the building blocks that go into them, right? If I don't have all the pieces and the signaling molecules that are necessary, I can't even make it to begin with, no matter how much I want to. So we have to have amino acids, right, to make those protein subunits. We have to have iron, right? That's commonly a reason why people end up being anemic or having low red blood cells is because they don't have enough iron. And then we have to have signaling molecules. So vitamins B6, B12, and folic acid are all kind of like stimulators or signaling molecules that are involved. So all of these things have to be present in high enough quantities for us to make red blood cells. Then we have a couple hormones that are related. Erythropoietin, and then also we have something called multi-CSF, or multi-colony stimulating factor. Multi-CSF stimulates all blood cells. We'll talk about it later. I think it's like at the end of part 3, we'll talk about it. But multi-CSF we'll see stimulates everything. All the white blood cells, the red blood cells, the platelets, it's like make it all. But again, we'll talk about all the colony stimulating factors later on in the chapter. Erythropoietin, or sometimes it's called erythropoiesis stimulating hormone. Do you think that increases or decreases the amount of red blood cells? Increases, right? Erythropoiesis stimulating. So it stimulates the production of our red blood cells. Erythropoietin is secreted by the kidneys, and primarily we see this being released when the amount of oxygen going to the kidneys decreases. Okay, so low oxygen out in the periphery, we call this hypoxia. Remember, hypo means below, right? So too low, lower than normal. So hypoxia is low oxygen. When we don't have enough oxygen going to the kidneys think, wait a minute, this is not okay. If I'm not getting enough oxygen, nobody else is getting enough oxygen either. So we need more oxygen. How do we get more oxygen? Well, let's increase the way we deliver it, right? Let's have more red blood cells, and maybe that will help us deliver more oxygen. So when the kidneys aren't getting enough oxygen, they release erythropoietin, and then that stimulates red blood cell production. Okay, so along the whole chain. Stem cell division, it increases hemoglobin synthesis, and just overall, the number of red blood cells that we're making is stimulated by EPO. Now, we see that erythropoietin gets released in multiple different situations that you would see occur on patients, but again, it's always related to hypoxia, right? It's always related somehow to there not being enough perfusion, or enough oxygen rather. So we see during anemia, anemia is just, if you haven't had lab yet, decreased red blood cells. Okay, so if you don't have enough red blood cells, you're not going to be delivering enough oxygen, so it makes sense that you need more red blood cells. When there's decreased blood flow to the kidneys, we see this. So if you're not having enough blood coming to the kidneys, obviously you're not delivering enough oxygen to the kidneys. So it makes sense to make more red blood cells. 1, you can deliver more oxygen, but 2, you have more blood. Remember, your red blood cells are like half the volume of your blood. So if you start making more, you have more blood volume, you can deliver more blood. Okay? And to the kidneys, because of course that's where it's released from. And then we also see it when the amount of oxygen that's coming in decreases. Because again, you don't have enough oxygen coming in. The kidneys think, okay, the only way I can help with this is by increasing the amount of red blood cells to deliver whatever oxygen it is that we do take in. We see that with some disease states, like chronic lung disorders, like COPD, emphysema, lung cancers, anything that decreases the amount of oxygen that you're bringing in. And then we also see it in high altitude. So remember, in high altitude, they say like the air is thinner. That's why it's like hard to run like marathons or play sports in Denver, right? Because that high altitude, you're not getting, there's not the same amount of pressure of the oxygen to push that oxygen in your body. So when you inhale, less oxygen actually crosses into your bloodstream. So in really high altitudes, you would release erythropoietin to make more red blood cells. So whatever oxygen you do take in gets taken up and delivered to your cells.
So is that why it's called doping? Like when they come from high altitude?
Why it's called what?
Like doping?
Oh, it's like when you come back, it's like all of a sudden you've got all these extra red blood cells, and so you've got like awesome oxygen delivery. Or like when football teams go to Denver, it's like they always say that the opposing team's at a disadvantage because they're not used to that altitude, whereas those players are. This is just kind of FYI, guys. Again, I like these little charts. Just I think they're easy for you to keep later, and like when you're reviewing for your MCAT or your boards or whatever, you can kind of like flip through these and have tons of information really rapidly. We talked about the hematocrit already. We talked about it in the lab too. The hematocrit, remember, was just a blood test that tells us the formed elements. And the formed elements are mostly what? Red blood cells. So the hematocrit essentially is telling us how many red blood cells we have. Again, from lab, but polycythemia is an increased hematocrit, so increased red blood cells. Anemia is a decreased hematocrit, so a decrease in the number of red blood cells. We also, a lot of times, will measure the hemoglobin concentration, or a patient will get an H&H, hemoglobin and hematocrit. Okay, so we're measuring both in that. But again, this is just kind of FYI. I won't test you on anything on there that we did not talk about on other slides. And this is just some details about red blood cells. Okay, again, it's all the stuff we've covered if I expect you to memorize it. All right, so I'm going to take the last like 15 minutes of class to get started on blood types. Hopefully we can get through at least a decent amount of this. So we're going to talk a lot about blood type. And in order to understand blood type, you have to understand something about surface antigens. Okay, so like what a surface antigen is. A surface antigen is a glycoprotein that's on the surface of the plasma membrane. Okay, so it's this little glycoprotein that sticks out from the plasma membrane outside of the cell. And it identifies the cell to the immune system. So think of it like an ID card, right? If we all walked around with little ID cards that said who we were and how we were doing at that point in time. That's what a surface antigen is. Now, the immune system constantly roams around, like so your white blood cells, all of your immune system components are roaming around looking for abnormal antigens, right? Because they want to know when something shouldn't be there, and the only way to know is to check the ID. So the immune system will look at the surface antigen and they'll make sure that it's self. If it's a non-self cell, it should not be there, and the immune system destroys it. If it's a pathogen, right, like bacteria, then the immune system will see an abnormal antigen and destroy it. Or if it's one of our cells that's not right for some reason, then the antigen will show that. You'll show an abnormal surface antigen, and the immune system will see the abnormal ID card and will destroy it. So that could be like one of our cells that has a virus in it. The viral DNA will start to show up on the surface antigen. Sometimes our cells go rogue and they become cancerous cells. That should show up on the surface antigen. Old, worn out cells, that should show up on the surface antigen. So that little ID card is constantly being scanned by the immune system, and anything abnormal gets destroyed. And your cells are all going to have these surface antigens that identify them as normal, healthy self cells. That includes your red blood cells. Okay, so your red blood cells have surface antigens that identify them to your body as your cells. Now, when we look at your red blood cells, the surface antigens that are present are what determine your blood type. Okay, so there are multiple different types of surface antigens. We have A, we have B, and we have something called RH. Whatever combination of those you have or don't have is going to say what blood type you are. Okay, and this is all genetically determined, so your genes determine what surface antigens are actually going to show up on the surface of your red blood cell. So we're going to do like a super basic version of this first, and then I'm going to complicate it a little bit. Okay? So the basic version, 4 basic blood types: A, B, AB, and O. If you have A blood, okay, A blood, then your red blood cells have surface antigen A. Okay, so this is your red blood cell, and it has these little identifiers on it that are shaped like the A surface antigen. That's what your red blood cells all look like. If you have type B blood, then you have surface antigen B, right? You do not have A, you only have B. And that's what your red blood cells look like. If you have type AB, you have both. Okay, so you'll have A and you'll have B. If you have type O, you don't have either. Okay, so your red blood cells do not have A antigen or B antigen. Okay, you are lacking. That sounds bad. It's actually good to have O blood, but you don't have the antigens. Now, this is what your red blood cells look like. That's how they identify themselves to your body. Your body knows what kind of blood you should have, right? So your body knows A is normal, or AB is normal, or none of these is normal. The way your body knows that is that you naturally have something called antibodies present. Antibodies are immune system components that attack antigens that should not be there. Okay, so you're going to have antibodies that attack anything that is not you. So if you have, we're going to kind of like take this information and put it up there, right? So if you have A blood, you're going to have floating around your bloodstream antibodies that attack B, because B is not you. Why wouldn't you have antibodies against A? Because A is you, right? You don't want to attack yourself. So you would have antibodies against B. If you have type B blood, you have antibodies against A, because A is not you. If you have type AB blood, you do not have either antibody. You don't want anti-A or you'll attack yourself. You don't want anti-B or you'll attack yourself. So you don't have any of those antibodies. What do you think about if you have O? Both, right? You have anti-A antibodies and you have anti-B antibodies. Because neither one of those are you. Yes?
So if you have AB blood, would you get either A or B blood, or would you just
Yes.
have to get AB blood?
Nope, you could get either.
Oh, okay.
Because you're not going to attack anything. You don't have antibodies to attack anything, so you're fine with whatever we throw at you. So, agglutinogens is a term that we give to antigens on the surface of our red blood cells. And the reason that we call them agglutinogens is because they have the ability to agglutinate. Okay? And agglutinating is clumping. So we kind of take advantage of this when we test for blood types. The fact that we can make something agglutinate, we can make it clump, and that will tell us what antigens we have present. So what I mean by this is we have, so say you've got red blood cells here, and I don't know what type of red blood cells they are. So I can add antibodies to it, right? I can add B antibodies, and nothing happened. The blood didn't clump, right? It didn't agglutinate. So these antibodies didn't find their antigen. Now if I try and add anti-A antibodies to this blood, and all of a sudden it starts clumping, it agglutinates, That's because these antibodies found their matching agglutinogen. Okay, so we found that when they match up, we have something called agglutination occur. Agglutination, again, just means clumping. When it agglutinates, it clumps. And again, this is what we utilize when we try and test blood to see what blood type it is. Okay, we have blood and we add an antibody. If it clumps, that antibody found the antigen. If it doesn't clump, the antibody didn't find its antigen, so it must not be present. We'll talk through that process a lot. Okay, so we'll go through a lot. And remember with the video too. So let's just do this super quick. Hopefully this makes perfect sense right now. This is a person who has type A blood. What antigens do they have on their red blood cells? A. Anything else? No. Yet. You know what, we're gonna mix it up, but not yet. And then what antibodies do they have? B, right? They've got anti-B antibodies. They want to fight B because B is not self. Type B blood has surface antigen B. And what antibodies do they have? Anti-A. They want to fight A. A is not self. If A shows up here, something is wrong because that is not that person's blood. Okay, that's something foreign. Type AB blood have A and B. So what antigens? None. They don't want to fight themselves. Right? There's no reason to start killing all of their own cells. Type O blood does not have those antigens. So it has antibodies that fight A and B. Okay? Now, let's mix that up a little bit. When you look at your blood type, do they say you're just A? Or do they say, what do they say? A positive or A negative, right? I'm A positive. I always got good grades. That and Smarties. I eat Smarties before tests, and I swear it gives you good mojo. Okay, just joking, kind of. So we also have another antigen. Okay, we've got A and B, and then we have something called RH, or sometimes it's called D. So just D is the same thing as RH. Okay. The reason it's called the RH factor is because it was first identified in the rhesus monkey. Okay, rhesus spelled with an RH. So they just took from that species of monkey and said RH factor. Everybody is either RH positive, meaning they have the RH antigen, or RH negative, meaning they do not have the RH antigen. So whatever other type of blood you are, you're either positive or negative. So if you're A positive, you have A antigens sticking out and RH antigens. If you're A negative, you only have A antigens. If you're O positive, you have RH. That's it. Right? Because the positive means you got the RH. So everything is either positive, meaning it's got RH, or negative, meaning it does not have RH. Now, this is where it's a little bit different and why we don't talk about this at the exact same time as the other ones, because the antibodies here are weird. If you're RH positive, okay, that means that your red blood cells have the RH antigen, right, the RH identifier, you're positive. That means your blood will never have anti-RH antibodies because you don't want to fight yourself, right? If you have RH antigen, you don't want to fight yourself, so you would never make something that's going to attack that RH. However, if you're Rh negative, right, that means that your red blood cells do not have the Rh antigen. You do not naturally make antibodies against Rh. Now, notice that's different, right? Remember, if I have, so say I have A negative blood, right? My red blood cells have what? This person will be born like this. They have A antigens, they're negative, so they do not have Rh antigens, okay? Because they're negative. Negative for Rh, no Rh. They have B antibodies to fight B because B is not self. They do not naturally have anti-Rh. At this point, this body has no idea that Rh even exists. You're not born able to fight Rh if you're negative. you have to be what we call sensitized first. You've got to have some Rh positive put into your body, and then that alerts your body, holy Lord, something exists, this isn't me, I need to fight it, and you start to produce antibodies against it. Then from then on, you have antibodies against it, but you're not born with them. And again, this is important. This is going to be important, especially for women. Anybody who's had a baby, what's one of the first things they ask you? Your blood type and the daddy's blood type, to figure out if it's possible for you and the child's blood to be non-compatible. Okay, so this is really important clinically, but I think I'm out of time. So, yeah, this is an important discussion next, so I'll save that for the next lecture. That's my hook to keep you coming back.